Hi, I'm Congressman Don Bacon from Nebraska's 2nd District. Thank you all for joining us today for Brain Injury Awareness Day. I spent 29 years in the United States Air Force and retired as a Brigadier General. I saw firsthand how TBI impacts all Americans, including our servicemen and women. That is one of the many reasons I'm honored to serve as a co-chair of the Congressional Brain Injury Task Force. I would like to personally thank my friend and co-chair, Congressman Pascrell, for his hard work and dedication to this task force. I look forward to working alongside him and continue to bring more awareness to brain injuries. TBI affects all segments of our society. It is easy to think of TBI as just an injury for professional athletes or other physical occupations, but TBI can result from a range of incidents including motor vehicle accidents, physical violence, recreational activities, and even simple falls. In the United States, 4.8 million people are evaluated in emergency departments for TBI each year. And in 2017, 2.5 million U.S. high school students reported experiencing at least one concussion. In Nebraska, more than 10,000 people of all ages are diagnosed with TBI each year, but many go undiagnosed and untreated. Rural populations have higher incidence of TBI, and they have poorer outcomes and often experience longer times to reach care. Those who live with long-term consequences from TBI may require accommodations to simply live in society successfully. A significant brain injury sustained by one family member can cause emotional, physical, and often financial disruptions to the family system. It is estimated that with more than 2 million TBIs a year in the United States, the lifetime cost could be as much as $750 billion. Individual, family, community, and societal costs from TBI are too high, way too high. As I said earlier, the TBIs affecting our service members and veterans is particularly personal to me. Since 2000, more than 439,000 service members have been diagnosed with TBI. Half of U.S. Army soldiers report experiencing a TBI prior to enlistment, and 1 in 5 reports experience a TBI during their active duty. TBIs are associated with adverse mental health outcomes, including post-traumatic stress, anxiety, depression, and suicide. TBIs are an opponent just as dangerous as an enemy on the battlefield. It is our job to make sure our people are equipped to handle any foe, and this one's no different. I am glad to share that through the combined efforts of the Brain Injury Task Force, we were able to secure an additional $175 million in TBI and mental health research in the fiscal year 2022. And there was $5 million for wearable medical devices for TBI prevention. We are particularly grateful of the work of the Department of Defense and what it's done on obtaining FDA approval for a portable TBI diagnostic tool and blood-based biomarkers to support TBI identification and care. With strong funding, we must now turn our attention to defining our goals and achieving real results. As the Republican lead on the BRAIN Act of 2021, I have pushed for an establishment of a Neuroscience Center of Excellence at the FDA. The Center of Excellence, if established, will help improve guidance, regulations, and research surrounding conditions impacting the brain. I was an original co-sponsor of Congressman Pascrell's TBI and PTSD Law Enforcement Training Act to establish crisis intervention training tools for first responders to address individuals with traumatic brain injuries. Finally, I was an early co-sponsor of the Veterans National Traumatic Brain Injury Treatment Act to start a 5-year pilot program so that veterans with TBI and PTSD would be treated with hyperbaric oxygen therapy so they could potentially live a better life. Our veterans deserve every chance at a better life. We have come far, but there's still more work to do. The United States lacks a comprehensive framework for addressing TBI. Too often, cases of TBI go undiagnosed or misdiagnosed or untreated. Most of the general public is unaware of TBI symptoms and does not know how to respond properly or treat them. We need to ensure adequate access to TBI programs and help after diagnosis, and we need to be more educated on TBI symptoms and causes. The nation needs, but lacks, the leadership to provide a focus for innovation and improvement in TBI care and research. Those here today can be that leadership. Thank you. Thank you for your time, and thank you for your combined efforts to make a difference in traumatic brain injury.